Often when you think of patient experiences, you tend to think of field or clinical staff. But many of us know our patient experiences are all-inclusive and can be impacted by individuals from across BJC, whether it be a medical equipment driver, a billing representative, or in this case, an administrative assistant. Darlene is an administrative assistant with our document center, which gives her the opportunity to interact with patients on a daily basis. I would like to tell you about a recent example of how Darlene provides excellent care for our patients. Melba Hale, our rehab manager, was in a meeting when Darlene came to the door with a look of concern on her face. She said she had a patient on the line who was very upset and she didn't want to send him to voicemail. Melba returned to her desk to take the call and within seconds knew that Darlene had done the right thing in not sending the call to voicemail. He was very upset and very frustrated. He hadn't had a very good hospital experience, and since he'd gone home, he had seen our nurse, but he hadn't heard from therapy yet. And it wasn't just because of his own impaired mobility, but it was also because he was the caregiver for his wife who has dementia. He told Melba he needed to see a therapist that day, and she could tell that he meant it. She asked what his greatest needs were, and he told her he needed to go downstairs and he would like to take a bath. She told him bathing would be addressed, but that the therapist would only take him downstairs if it was safe. She then asked him to give her 30 minutes to an hour to go ahead and get the therapy visit scheduled for him. And he said, okay. So our therapy staffers were able to then, within an hour, get an occupational therapy visit scheduled for that day and a physical therapy visit scheduled for the following day. When Melba called him back to let him know that the occupational therapist would arrive shortly, he was very grateful, and she could hear his wife in the background asking questions with concern and anxiety in her tone. And then he stopped and he said, Darlene, it's going to be okay. I'm going to be okay, and you're going to be okay too. This call could have easily ended with a transfer to voicemail, but that would have left him without the answers he needed. Darlene took ownership of his problem, even going so far as asking Melba to let her know how things turned out for him. She showed him care and compassion, and through this, she was able to provide him with an excellent patient experience.